Taking Care of You, Managing Stress and Depression, Part 2, presented by Dr. Michael Howard.
Now, in this brain model up here, which part of this brain do you think you activate to manage stress, to cope with anxiety, and to beat your depression? Your frontal lobes. Right up here, we're right back at this Mr. Inhibition and Miss Inhibition up here, right up here in this front part of your head up here. When I work with people that have chronic stress, first of all, there's some mental disorders in which you must treat them with medications. And you heard about some of them this morning. If somebody really does have schizophrenia, that's a very small percentage of our population that really have schizophrenia. These folks all need counseling, often behavioral and cognitive behavioral, and they all need often individual and social support and skill training, we now know. What if you've got attention deficit hyperactivity? You heard about that this morning too. I totally agree with what Dr. Oshanik told you and what people like Dan Amen and lots of other folks I've talked to about this. If you got ADHD, before you ever get anybody any medication, look at structure, look at sleep, look at nutrition and hydration, look at exercise and all that before you ever give somebody a medication. But medications are the things that work better with ADHD than anything. The data is really clear about that. So how about bipolar disorder? You got to treat bipolar disorder with medications, in addition to therapy and structure and all that. But guys, despite what you saw with the anti-anxiety medications this morning, the outcome data is very clear. Medications seldom cure anxiety disorders. Seldom. Now they can help, they can blunt your fear to some degree, but they don't cure these disorders and they don't cure chronic stress because stress and anxiety are due to what? Thinking. So what do you have to change to make these disorders go away? Thinking. Now, how about depression? You saw a bunch of antidepressant drugs up here. How effective are they? Guys, if you want to know about depression and how effective the drugs are, I advise you read one study. Now, there's a ton of them out there. I can give you all sorts of meta-analysis, all kind of interesting stuff. But I would read one study. I'd go to Google and I'd put in STAR asterisk D, STAR D study. That stands for Sequence Treatments Alternative to Relieve Depression. What do you think the typical person with depression is? In some psych hospital somewhere? What's a typical person with depression? They're what we call an outpatient. They're somebody living in the real world with depression. They're being treated for depression. And what's the treatment you're almost always going to get? Some kind of medication. This study gave 5 different, here's what they did. They took about 2,000 people and they gave them one antidepressant drug called Celexa, citalopram, at the typical dosage you would give. And they left them on it for 14 weeks, 3.5 months. Of these 2,000 people, how many of them you think were no longer depressed after taking this drug for 14 weeks? 1/3 of the people had gone into at least some remission during this time. That means 2/3 of the people are what? Still depressed. What do you do with them? Now, in the real world, if you treat them with meds, you up the dosage, you add a medication, or you substitute another one and try something else. They didn't do the dosage changes here. What they did was they went through 4 more trials of changing different meds, adding different things in, trying different things. And at the end of 5, it's nearly a year and a half now, at the end of 4 more trials, only about 67% of these people, and it's arguable how much over, but about 60% of these people are going to remission. That means after 5 medication trials, 40% of these people are still depressed. Okay? Now, the reason I'm telling you this is to understand that there are other ways, I'll tell you this pretty quickly, and I put this in your handout, you can read this little handout you got there over time, that there are other ways to treat depression besides this. Certainly, our outcome data tells us that people that get cognitive behavioral therapy, a therapeutic approach by changing your frontal lobe thinking to depression, have about as good an outcomes as people that take medications. The really severe depressed respond slightly better to meds, the mild to moderate, slightly better to psychotherapy. But we know this. This is clear. In the average person with depression, therapy plus the medications has by far the best outcomes. And is that what you're going to get? Is that what you're going to get from your health program? No, probably not. Now, all that being said, Let's get back to what you can do. Everybody I treated and treat with chronic stress, anxiety, or depression, I start out by teaching them one thing first. Want to guess what that is? I teach people to meditate. I teach them, now meditation, there's about 50 to 60 different kinds of it. I use the kind that's 2,600 years old. I figure it's had enough time to kind of get figured out by that time. 2,600, that's mindfulness meditation. Do you know mindfulness meditation is so effective, they're teaching Marine Corps recruits at Camp Pendleton in California mindfulness training. How come? What does mindfulness do? What is meditation all about anyway? And I will tell you something, there's a huge amount of neuroscience on this. This isn't pie in the sky nonsense up here. What does meditation do? How does it work? I'm going to tell you something you're going to think is weird. I believe almost all psychotherapy is attention training. I really do. Cognitive behavioral therapy is attention. I teach this before I teach cognitive behavioral therapy because if you can't control attention, you can't really learn cognitive behavioral therapy. So what do you do? What do you do? You learn to focus on one thing. It could be your breathing. It could be the image of laying in a hammock down at Cancun on the beach or something. It could be anything you want it to be. Knitting, I don't care. But you just think about one thing. And as you're thinking about that one thing that's relaxing to you and all that you kind of like thinking about, what are you not thinking about? All the crap out there that makes you upset. All the crap out there. So by the process of elimination, just thinking about one thing begins to put you in a very relaxed, we call it parasympathetic state, part of your autonomic nervous system. It's in your handout. A nice relaxed little state where you can get into by just thinking about just one thing. Now, how hard is it, do you think, to learn that? Danged hard. See, I used a good word then. Danged hard. Danged hard to learn that, all right? Because let me tell you something you may not know, but what the new cognitive psych stuff tells us. As you go through the day, all day long, do you know 30 to 50% of the thoughts that come into your frontal lobe that you're thinking about is just random crap? It's got nothing to do with nothing. Now think about that during the day. All kind of, if this person really knew what this person was thinking, probably he'd want to sit clear down there, down the other end down there. We got all kind of crazy thoughts that come in our head all the time because it's just a natural phenomena that things just pop into our heads constantly. And when you learn to meditate, you've got to screen those things out because when you first learn it, they're going to constantly bombard in there. So you just try to meditate for 20 seconds. And then for maybe 40, and then a minute, and then 2 and 3. It's a skill, and you got to practice it. And my therapy patients, they got to practice it. Because once you learn to really meditate and you can sit and just think about one thing for 5 minutes or 10 minutes and your body just goes in that relaxed, non-stressed, parasympathetic. Herb Benson at Harvard calls it the relaxation response. You just go in that relaxation response. You're not only learning to relax yourself, which takes you out of the stress response, because the stress response is an all or none phenomena. You're either in the sympathetic part of your autonomic nervous system stress response or you're in the parasympathetic non-stress. You can't be in both of them. You got to be in one or the other. So if you're not stressed, you're relaxed. But that does something else that's cool. You don't only learn to do that, but you teach somebody who's in chronic stress, anxiety, or depression that they can control their what? Their thoughts. Their thoughts. Because where do you think your emotions come from? They come from what we technically call, is it the little technical word for it, called cognitive appraisals. Your emotions come from your perception of the world that occurs back here. You know, your touch is here, and your vision's here, and your hearing's here. They're all mixed up a lot more than we used to think they were, but they're all but your perception of the world first, and then your frontal lobes up here in front think about those perceptions. And the combination of these things programs the emotion that you're going to feel. So if you're going to change the crappy emotions that are kicking your fanny all day long, fear, sadness, anger, they go on and on and on, where do you intervene to do that? Well, you could try the perceptual stuff with behavior program. We can try that. But mostly the best way to intervene is to intervene with your thinking. But before this is going to work, you got to at least believe you can control your what? Thinking. And you know, I'll tell you something. Most people, and a lot of you have been through this, most people who are chronically stressed and chronically anxious and chronically depressed do not feel that they're in control of their emotions, and they think there's nothing you can do about it. One of the empowering things that you get with people that learn meditation is they now believe they can control their thinking. And I don't believe you can teach somebody a cognitive behavioral modification therapy until people believe that you can actually change your thinking. And that's what meditation helps you lead. Now, when it comes to this cognitive behavioral therapy, this is your second thing now. Once you learn to meditate, how do we fix stress and anxiety and most depressions? You know, 2/3 of all depressants have high cortisol level and salivary cortisol. That means stress and anxiety is a huge part of even most depressions. Depression is a more complicated phenomena, but nonetheless, it's really part of it. So once you got somebody that learns to relax and to change their thinking, how do you get them to all of a sudden change these negative thinking patterns that are creating these negative emotions? Well, first you've got to identify them. You know that the truth is, some of these negative thinking patterns that we have, we practice them so many times, they become automatic habits that we do without thinking. Something happens around us, and we're PO'd about it in a New York minute, without even thinking why, because of this. So sometimes one of the first things you have to do is get people to find out exactly what it is they're thinking that's creating these negative emotions that are coming up and making their lives so miserable. Once you've identified those things, you try to find other thoughts that you could substitute to those that make them more likely. I'll give you a real interesting example of this. I came across a staff member who used to work for me, and he invited me to his house for dinner. So I went over to his house for dinner. He's got a 15-year-old daughter. Now, as we all know, this is the epitome of rationality and impulse control, okay? We all know that's right at the top. But let me tell you something about this girl. We're sitting around the table, and she was raised on a cognitive behavioral model philosophy. She was raised by her father, and father believed in this because they both worked for us at Tangram. Listen to this. We're around the table, and she says, Dad, today my math teacher, Mr. So-and-so, so-and-so, he said this and this to me, and Dad, I almost made myself mad at him. Now, I want you to listen real close to what she said, because it's subtle, but you can't believe the power that's behind this. This girl has been raised. That's all right. This girl has been raised to believe that her emotions are under whose control? Hers. How many people in this room, if you'd have said the same thing, would have said, that no good son of a gun almost made me mad? Every time you say that to yourself, she made me mad, he made me happy, that made me upset, you're telling yourself your emotions are under somebody else's control and not yours. You can't believe how powerful this is to have that belief system. You tell yourself that over and over again. 2 weeks ago, I was doing a seminar up in Washington State. I don't know. I get mixed up where I'm at from week to week, and I'm disoriented most of the time. But somebody said in the back, she says, taking care of my brain-injured son stresses the hell out of me. Does it? The point is, that's a stressor, no question about it. But how much and whether you get stressed about it depends on how you perceive and think about it. It's where the fear of the stress is going to come from. You understand? It doesn't mean you're irrational about it. It means you can think about things in different ways to make them less threatening and less fearful to you when you do it. And that's what cognitive behavioral therapy is all about. It's based on neuroscience. It's based right up here. Let me tell you something you're going to think is weird. If you're chronically anxious or stressed or depressed, and this has been going on for 5 to 6, 7 years, your amygdala here that produced those negative emotions has grown in size anywhere from 2 to 7% in size because the fear coming out of there is kicking your butt up one side and it's rocking and rolling, okay? What happens is, when we look at, and say you put your head, remember Dr. Shank was telling you this morning about PET scans and functional MRIs that measure the metabolism of the brain. You know what happens? When we put the person in the head with a PET scan, this amygdala is hugely overactive. It's lighting up like a Christmas tree up there because it's throwing huge amounts of sadness and fear and anxiety up here into your consciousness. And the frontal lobes up here, guess what's happened to them? The cortex, the outside rim of your frontal lobes up here, has shrunken 8 to 14% because their frontal lobes are not doing their job. And you've got all kind of, he told you about the serotonin, the norepinephrine, the dopamine, you've had all these changes up here that occur. But to just look at it in this way, when you're stressed and anxious and depressed, your negative emotions are powering into your consciousness and they're out of control. That horse is leading you around and you can't do squat for where those emotions are taking you. As soon as somebody learns to meditate, that immediately begins to change. The frontal lobes become more metabolically active and you start seeing a diminishing in the activity in your amygdaloid complex. It's not just this, there's several structures involved in it, but in this area down here. And as you go through cognitive behavioral therapy and learn to change the way that you think about these stressors, to change the way that your emotions are produced to them, eventually you'll see the frontal lobes bring themselves back up to normal size, and you'll see the amygdala shrink back down to where it belongs and become less active. Meditation and cognitive behavioral therapy change your brain just like a medication would. You biochemically and neurochemically and physiologically change your brain when you do these things. Somebody in chronic stress, anxiety, and depression has a changed brain. And if you fix it, you got to change it around. And where you can intervene with that is up here where you actually think. Because this, right around this pathway, is going to inhibit, remember all that inhibition stuff he told you about? The frontal lobes inhibit negative emotions, but they tend to be able to empower positive emotions. Okay? That's what your frontal lobes do. For the most part, when we're talking about stress, anxiety, and depression, we're talking about inhibiting those negative emotions that we already sit on a hair trigger to feel anyway, because back in the Stone Age, they saved us. You want to read a great book on stress? One you can get at the bookstore pretty cheap, and written by a fascinating guy I've talked to a number of times. There's a guy at Stanford called Robert Sapolsky. You know the book he wrote on stress, you know what it's called? Why Zebras Don't Get Ulcers. Why Zebras Don't Get Ulcers. Now, you tell me, how come zebras don't get ulcers? Because they can't think. They can't think. Now here, let's think about this now. Here's this zebra out there, kind of chomping around out here. And about 500 yards away on a hill up there are lions looking at this zebra like it's the next lunch they're going to have. What's the zebra doing? It's just sitting there eating like this. And as soon as he sees the lion coming or hears it or smells it coming through the bush, it's going to run like a scalded dog and go right into a stress response. But it ain't. Now what if it was us? Oh my God, there's lions up there. What am I going to do? Oh my God, if I go this way, it might get me there. What if I go over here? Oh God, there might be one over there too. What am I going to do? I don't know what I'm going to do. We'd be sitting there worrying ourselves to death. Zebras can't think and imagine the future. They ain't worried. The point is this. If you can control your thinking and learn to think about things rationally, but that don't over-put yourself into a state to make you more afraid than you should be, your life will be enormously better, and the chance that you will develop chronic stress, chronic anxiety, and chronic depression go hugely down. Let's take the percent of the American population. How many do you think have a diagnosable mental disorder?
90%.
No, it's about 26 to 27%. 1 out of 4 people have a diagnosable mental disorder. Okay? Want to know what the vast majority of those are? Schizophrenia? Bipolar? Those are rare disorders. The huge percentage of these people, it's chronic stress, chronic anxiety, and 2/3 of all depressions are stress-related. This one survival stress response is built into all of us. When it goes out of control, creates nearly all the mental disability we have in our culture. And it's a natural thing. It's a natural thing that's already inside of our heads up here. There's nothing, it's there. It's built, and the reason is, of course, kind of the last little thing to wrap this up. The reason is, of course, we were never really genetically designed to live in this world. You know that there are Stone Age cultures left on this planet? If you go to the Tiv in central Nigeria, the Ikong, if you go to the Yafore in Papua New Guinea, if you ever read Jared Diamond's Pulitzer Prize winning book, Guns, Germs, and Steel, you learn a lot about the Foray, this Stone Age tribe in Papua New Guinea, who lived pretty much like we did maybe 13,000 years ago. What, you think these people run around being worried all day about their 401ks? About what traffic's going to be like? Driving in and out of Orlando? Whether your airplane's going to end up being on time? Whether or not you're going to get a raise next time? What about paying your bills at the end of the month? These people are just trying to get through today. They're trying to find enough to eat, take care of themselves to get through today. We live in a future-oriented society with delayed rewards. Why'd that poor soul, Greg Oshanik, go through 4 years of medical school and God knows how long of residencies and all the training he went through for a future goal out there that was 7, 8 years, 9 years in the future? A lot of our lives are spent for goals we have no control, and he has no control over those goals. So if you set your life up to worry about things you have no control over, let me tell you something I wrote a book about, and I ain't trying to sell it to you because you can only get it if you come to seminars and stuff that I give now, but I wrote a book called Living to be 100. It's about how people live to be 100 years old. Now, there's 307 million Americans. How many centenarians do you think we have, people over 100 years old? You want to take a guess? In the United States. How many centenarians do you think we have? About 307 million people. 60,000. How many of you think can live independently? I mean, live on their own, take care of themselves, pay their bills, and of course, if they live in Florida, drive cars and run over people on the sidewalk for fun. That's a state sport. I live down here, I know, that's a state sport down here. Here's what I found in this book. I found 70% of the variance in living to be 100 years old and still living independently, and guys, these are the most amazing people on the planet. We ought to be worshiping them instead of the Kardashian sisters, who these people always seem to think are so fascinating. We ought to be worshiping these people because they've lived longer, better, happier, and healthier, and are more cognitively and physically intact. None of them have dementia. 30 to 50% of 85-year-old people these people completely avoided it. Now, I found 16 things that predicted this, 70% of the variance. And it doesn't take a genius to do this, okay? I looked at the 24 studies, interviewed a bunch of them myself. It's easy to do. 3 of them are hugely relevant to us today. Number 1, these are probably the best stress managers on the planet. They're resilient, as Tom Pearls calls them in the New England Centenarian Study. They've not had long-standing periods of stress and depression, and they're incredibly socially connected, and they get enormous social support from people around them. Welcome to 3 huge secrets of life. And here's the last thing. Let's suppose we talk about how do you have the longest, healthiest life you can. Do you think that people that don't worry about anything, that don't stress themselves out about nothing, live long? No, they don't. They die young. These are people that say, oh, I got a lump in my breast, so what? You know, if you don't worry about nothing, you're not conscientious enough to really take care of yourself. How about the people that worry all the time? They die young too. So who lives the longest? The term and longevity study in California has already studied this. Who lives the longest? In statistics, we got this thing called a Yerkes-Dodson curve. It's an inverted U, looks like this. Who lives the longest? The people in the middle. And what do you think they're worrying about? They worry, but what do they worry about? Let me tell you about a buddy of mine. Smartest guy I think ever met. I gave him a Wexler Adult Intelligence Scale when I was training to be a psychologist. He got a perfect score. He never dropped a single point, but he just had his whole colon taken out. He's got, and it's on a bag. He's got ulcers, big time, huge high blood pressure, because he worries constantly about national politics. Now, this is going to illustrate my point to you. The people who have the longest, healthiest lives, what do they worry about? Stuff they can control and fix. And then once you've done what you can do to control and fix it, you put it behind you and move on. You know, Tom Pearls, in his first cohort of the New England Centenarian Study, had 4 people in it who were Nazi concentration camp survivors. That may be the most awful thing a human being, stressful situation, could go through, and they lived through it, coped with it, put it behind them, and moved on. The secret to life, folks, is not how much crap the world throws you. It's what you think about the crap the world throws you. That's what's going to decide whether you get depressed or not, or stressed or anxious. And if you do, the 2 main things to do about it, while medications can help and all that, you learn to focus your attention by meditating, and then you learn to think about the kinds of thoughts that are going to make you feel good, or better at least, than make you feel bad. It's a choice. It's a choice. When I was in combat, I saw guys go to pieces. In the same situation other guys went through and coped with it just fine. Combat never stressed anybody. What you think about that combat and the emotions that you get to it, like anything else, that's what determines whether you're going to be stressed, anxious, or depressed. So, long story short, if you're around stressors, and nearly every one of you are, how are you going to keep it from putting you into chronic stress, anxiety, and depression? And how important is this? There's about 50 people sitting in here probably. Okay, we got 50 people in here maybe? What do you think is going to kill 37 of you? Stress. Well, the top 7 cause of death. You know, there are about 100,000 diseases, the International Classification of Diseases 10. You ain't got squat to worry about most, even 99,993 of them. 7 diseases are going to kill 3 out of 4 people, nearly 4 out of 5 people sitting in this room are going to die of 7 diseases. What are they? Heart disease, number 1. What's number 2? Now, all the cancers added together. And by the way, in 10 years, I think cancer will be number 1. But nonetheless, right now, it's heart disease, cancer, number 3, stroke, number 4, chronic obstructive pulmonary disease, emphysema and all that. Number 5, the ugly D word, no, dementia never killed anybody. Actually, you're not going to find dementia in anybody's death certificate. The 6th leading cause of death, it's diabetes. Type 2 diabetes, 90% of the diet. The 6th leading cause of death is the accidents. The 7th leading cause of death is pneumonia and flu. Listen, folks, chronic stress, chronic anxiety, and chronic depression are huge risk factors for all 7 things that are going to kill 3 out of 4 people in this room. This isn't just about your mental health. Dealing with stress, dealing with anxiety, dealing with depression, and coping with it is about your physical health and your ability to take care of the person you're trying to take care of. If you can't take care of yourself, you'll not be taking care of them. And it not only is your physical state at the time, it's the rest of your life. Goodbye.
To learn more about resources and information provided by our experts, call Brain Injury Association of Florida's helpline at 800-992-3442.